My name is Jenny Hebert-Byrne. I'm an associate professor in the Division of Community Health Sciences and the School of Public Health at the University of Illinois, Chicago. I'm presenting our abstract, Social Processes Informing Toileting Behavior Among Adolescent and Adult Women with Using Social Cognitive Theory as an Interpretive Lens on behalf of the NIH-funded Prevention of Lower Urinary Tract Symptoms and my colleagues listed here. I have nothing to disclose. I'd like to share our findings in the context of our research consortium and the study of habits, attitudes, realities, and experiences from which the data come. The Prevention of Lower Urinary Tract Symptoms Research Consortium really emerged from the belief that bladder health promotion and LUTS prevention require an expansion beyond the traditional research paradigm of focusing on disease treatment to developing really the evidence base that will lead to recommendations that promote bladder health for adolescent women and girls. And this requires defining bladder health, building a conceptual framework, using community engagement principles in our research, and working in a transdisciplinary way. Our study aimed to explore adolescent and adult women's experiences, perceptions, beliefs, knowledge, and behaviors related to bladder health and function across the life course. The aim of this particular analysis that I'm sharing with you today is to gain insight into those underlying social processes that shape toileting behaviors and habits, of which we know very little. This is a focus group study. We conducted 44 focus groups across the country. We engaged 360 female participants across these age groups on the right-hand side. We conducted 6 in Spanish. We translated and transcribed verbatim, and we used focus group transcripts as part of our analysis. Our analysis employed 5 stages. We used a transdisciplinary interpretive lens. We created a code book that had codes that were deductive in that they were aligned with our conceptual framework and inductive in that they emerged from the data themselves. We identified emerging themes using a transdisciplinary perspective, and then we tested these themes with our community stakeholders in member checking sessions to test for trustworthiness. We then looked deeper into the codes around social process and those at the interpersonal level of our conceptual framework. And then we identified social cognitive theory as an analytical lens to further operationalize what emerged as our 3 domains of our overall social process. We were successful in recruiting a sample that was diverse by race, by ethnicity. We were interested in gathering women across geographies, and we recruited not with respect to LUTS status. What emerged in our findings was the social process of observing was really conceptualized on a spectrum ranging from random observations or exposures that occurred without method or conscious decision to purposeful surveillance or tracking over time that's conducted in an organized way. So the social process of observing behaviors really fell across these 3 domains: observing others' toileting behavior to determine norms and expectations, being aware that one's own toileting behavior is being monitored by others who might gatekeep or guide, and observing one's own behavior with others to assess its conformity to what are perceived as the subjective norms. So the participants' discussion of others' toileting behaviors really encompassed 2 themes: seeing voiding positions in toileting behaviors and attending to social context and interaction. Participants' descriptions of being observed seem to reflect experiences in 3 areas: the observations made by families or others that tended to want to help, observations made by teachers or supervisors in school or work settings that tended to seem to be intended to control, and then those observations of the impact of being observed, including concerns about what others would think. And this final domain, observing oneself to assess behavior relative to others, included benchmarking one's toileting behaviors against social norms or what were perceived as social norms, and includes seeking clarification about an experience compared to what may be perceived as the norm. We think there are some important implications for prevention here. These underlying social processes of toileting behaviors are seemingly private and largely stigmatized, but we think they may in fact be highly social. And health promotion efforts could leverage social networks for social norming interventions and engage systems representatives and policymakers to promote healthy toileting behaviors and endorse voiding autonomy. We want to thank our PLUS research members who contributed to this.